This is perhaps the most common, yet most overlooked, health interaction happening on millions of kitchen tables every morning. If you are over the age of 60, pay immediate attention. This message could save you an unnecessary trip to the emergency room. We are talking about two pills that feel completely safe. Two pills that are championed for heart health and longevity. One is your daily aspirin, often the low-dose kind. The other is your fish oil supplement, rich in omega-3s. If you combine these two every day, you are entering a high-stakes zone of risk that doctors are now warning about globally. You are dramatically increasing your risk of severe, often silent, internal bleeding. For decades, we have been told that aspirin is essential. It is a cornerstone of preventative heart care. You take it because your doctor prescribed it, or because you believe deeply in its power to keep your blood flowing smoothly and prevent clots. It is a necessary protection. And then there is the fish oil. Perhaps you started taking it for joint pain or to help with your brain fog. The science is overwhelming. Omega-3 fatty acids are excellent for reducing chronic inflammation and supporting cardiovascular health. You feel proactive, you feel protected. But here's the critical health conflict. Both of these powerful substances do the exact same thing to your blood, just through different mechanisms. Both of them actively thin your blood. When taken together, their effects do not just add up, they multiply. Imagine your body's natural clotting ability as a safety net. When you take aspirin, you make some necessary holes in that net to prevent dangerous blockages. When you add high-dose fish oil, you rip the net further. You are stripping away your body's vital ability to stop a simple, routine bleed. This combination creates a silent trap, particularly in your gastrointestinal tract, your stomach, and your intestines. GI bleeds are terrifying because they often start without pain. They creep up slowly. You might not feel sharp agony, but you might notice unexplained fatigue, unusual shortness of breath, or a persistent dizziness that wasn't there last week. These subtle symptoms are often dismissed as just aging or perhaps stress. Meanwhile, you may be losing blood internally. The severity of this interaction cannot be overstated. A recent clinical review found that patients combining daily aspirin with high-dose omega-3s had a significantly elevated risk of serious bleeding events compared to those taking aspirin alone. The research is forcing doctors to reassess standard recommendations for seniors who are diligently trying to protect their hearts. We understand that for many of you, taking aspirin is non-negotiable. You rely on it. We also understand the tremendous benefits that fish oil provides. The point is not to scare you away from these beneficial compounds, but to equip you with the knowledge to manage this combination safely. The danger isn't the pill itself. The danger lies in the unmonitored combination and, crucially, the dosage. When you reach for your bottle of omega-3s, you might see a number like 1,000 milligrams. That number is very important. But what matters even more is the specific amount of EPA and DHA listed below it. Too many seniors are unknowingly taking doses high enough to turn a protective routine into a high-risk gamble. We need to understand exactly how aspirin does its work and exactly how fish oil interferes with that work. Understanding the mechanism is the key to managing the risk. In the next part, we will break down the molecular action of these two substances. We will explain precisely how they thin the blood, revealing the specific dosage threshold of omega-3s that turns this helpful supplement into a dangerous cocktail when combined with aspirin. We will also reveal the warning signs of internal bleeding that are too easy to miss. Please stay with us. We have established the serious risk. Combining daily low-dose aspirin and high-dose fish oil creates a potent double-action blood thinner. But what exactly is happening inside your body when you take both? It's not just a simple additive effect. It's a conflict of mechanisms working together to strip away your body's natural defenses. Think of your blood's clotting ability like a repair crew. This crew has specialized workers called platelets. Aspirin's job is to block those workers. It handcuffs the platelets, making sure they cannot gather together quickly to plug a hole. This is why you take it, to prevent dangerous clots in your heart or brain. Now, introduce the fish oil, the omega-3 fatty acids. Omega-3s don't block the workers directly. Instead, they change the nature of the blood itself. They make the blood less sticky, less prone to grouping up in the first place. Imagine your platelets are like Velcro. Aspirin removes half the hooks from the Velcro. Fish oil applies a slick, oily coating to the remaining hooks. Neither substance alone causes guaranteed disaster, but together they leave your blood virtually defenseless against even a small injury. And there's one area of your body where this double whammy effect is most critical and most dangerous: your gastrointestinal tract, your stomach and intestines. Aspirin is notorious for causing irritation. Even in low doses, it slowly wears down the protective lining of the stomach wall. Think of it creating tiny microscopic scrapes or weak spots. When your body is working normally, your efficient clotting system rushes in and instantly seals these scrapes. It prevents a trickle from becoming a flow. But if your blood is hyper-thinned by the combination of aspirin and fish oil, those tiny scrapes cannot seal. The constant movement of digestion makes the bleeding persist. This is the hidden risk that doctors are urgently warning about: silent, persistent bleeding that you cannot see and cannot feel until it's too late. If this bleeding continues unnoticed, it leads to two major complications you must be aware of: iron deficiency and, ultimately, a catastrophic internal hemorrhage. We must now discuss the signs of trouble. It is vital that you know what to look for, as these symptoms are often dismissed as simple aging or acid reflux. The first type of warning sign relates to persistent, low-grade discomfort. If you suddenly experience chronic, unexplained stomach pain that lasts for days or weeks, pay attention. This is not heartburn that comes and goes. This is deep, gnawing discomfort, often worse after meals. Another serious signal is changes in your bowel movements. This is difficult to discuss, but necessary. If blood is leaking slowly in your stomach, it takes time to travel through your system. By the time it exits, it has oxidized. This changes the appearance of your stools. If you notice your stools are black, tarry, and extremely sticky, this is an immediate medical emergency. It is highly indicative of old digested blood originating from the upper GI tract. Do not wait for an appointment. Call your doctor immediately or go to the emergency room. A less common but equally critical sign is changes in your vomiting. If you vomit material that looks like coffee grounds, dark, coarse, and grainy, this is also digested blood. This means the bleed is rapid and substantial. Finally, watch for signs of anemia caused by slow, continuous blood loss. This is subtle and often blamed on being tired. If you feel sudden, profound fatigue that doesn't improve with rest, unusual dizziness or shortness of breath doing simple tasks like climbing stairs, you might be losing blood silently. Your body is trying to manage without enough red blood cells. These are the immediate dangers of the double-thinned effect focused on the stomach. The danger is real, and the symptoms, once they appear, require urgent intervention. But how much fish oil is too much? And what exactly should you say to your doctor if you suspect you are at risk? In our next segment, we will break down the specific doses and the safe strategies that allow you to manage your heart health without increasing your risk of internal bleeding. We've spent time understanding the mechanics of this dangerous combination. You now know that both fish oil and aspirin aim for the same target: reducing the blood's ability to clot. When taken together, they don't just reduce clotting ability, they often eliminate necessary clotting altogether. This makes the risk of a bleed, even from the smallest bump, far too high. But here is the immediate real-world difficulty. The bleeding we are warning about is often silent. It doesn't usually start with a dramatic emergency trip to the hospital. It starts small, internally, and manifests as symptoms we commonly dismiss as just getting older or a bad case of heartburn. This is the hidden threat that demands immediate awareness. You must become hyper-vigilant for these subtle changes, especially in your digestive tract. The stomach lining and the upper intestine are the most common sites for this combination to cause trouble. The first and most alarming sign of internal bleeding is often hidden in the bathroom. If you notice your stool is dramatically darker than usual, looking tarry, black, and sticky, this is a medical emergency. This color change means digested blood has been sitting in your system. Do not wait for this symptom to pass. Call your doctor immediately. This is not normal constipation or a minor upset stomach, but long before that dark sign appears, there are warning lights flashing. Be aware of chronic, unexplained fatigue. We often attribute exhaustion to a restless night or a busy afternoon. However, slow, constant internal bleeding, even a trickle, leads to anemia over time. Your body is losing blood faster than it can replace it. You feel drained, perpetually low energy, and sometimes dizzy when you stand up quickly. If this fatigue is a new, ongoing issue that started after you ramped up your omega-3 dosage, you need to pause and assess. Another critical indicator is changes in your appetite and stomach comfort. Do you experience persistent nausea that doesn't respond to typical remedies? Are you feeling full much faster than usual, or suffering from persistent, dull abdominal pain that seems unrelated to the food you ate? If your gut distress has become a daily companion since starting both substances, it is a massive signal that the lining of your stomach is under attack. Now, let's talk about external signs of this blood-thinning overload, signs that manifest on your skin. These are easier to see, but equally easy to ignore. Have you started bruising easily? We all get bruises, of course, but the key here is the size and the cause. If you wake up with massive purplish-black bruises from an impact you don't even remember, or if a slight bump against the corner of a table results in a bruise the size of your hand, your clotting factor is dangerously low. Your blood is simply running out beneath the skin, unable to seal the leak effectively. Pay close attention to your arms, legs, and even your face. Look for what doctors call petechiae. These are tiny pinpoint red or purple dots that look like a rash, but they are actually microscopic bleeds under the skin. They are a clear visual warning that your capillaries are bursting under normal pressure and your blood simply cannot clot to stop them. If you see these, it's a sign the blood thinning effect is overwhelming your system. What about visible nosebleeds? We know dry air causes them. But if you start experiencing nosebleeds that happen frequently, or critically, they take 10 minutes or more to stop, this is a dangerous sign of medication interaction. The same goes for bleeding gums after brushing. If your usual soft brush now leaves your mouth bleeding profusely, your clotting system is likely compromised by the additive effect of the aspirin and the fish oil. If you recognize any of these subtle symptoms, the new chronic fatigue, the unexplained nausea, the massive bruises, or prolonged bleeding, you must take immediate, careful action. Your first step is not to panic, and it is certainly not to abruptly stop taking your prescribed aspirin. Suddenly, quitting low-dose aspirin can trigger a rebound effect that may increase your risk of a heart event. That is why this process requires the direct involvement of your physician. You need to schedule an urgent appointment and be prepared to present all the facts clearly. Bring every single bottle of supplement and medication you take, including the specific brand and dose of your fish oil. Don't assume your doctor knows you take high-dose omega-3s just because you mentioned it months ago. Crucially, you should ask your doctor about getting a simple blood panel. Specifically, they may want to check your complete blood count, or CBC, to look for anemia caused by silent bleeding, or tests like the prothrombin time, or INR, which measure exactly how quickly your blood is clotting. These tests remove the guesswork and provide objective data on the severity of the thinning. Never assume that because a product is over-the-counter or derived from a natural source, the dosage doesn't matter. With the aspirin and omega-3 combination, the dose absolutely dictates the danger level. High-dose fish oil, even taken just twice a day, can push you into the danger zone when paired with your preventative aspirin. Remember, this hidden interaction is a stealth threat. It uses symptoms you already experience, tiredness, indigestion, to mask a serious underlying condition. Recognizing these signs is the essential middle step between identifying the risk and implementing the solution. In our final part, we will move from diagnosis to action. We will discuss specific, safe alternatives to manage inflammation and cardiovascular health without relying on high-dose omega-3s. We will also detail the safest possible protocol for weaning off this combination under medical guidance and establish a new, secure supplement routine. Stay with us for the crucial steps that could secure your health for years to come. This critical danger is often introduced not by changing prescriptions, but by tiny slips in your daily routine. We need to move from reaction to absolute prevention. Start today by conducting a complete audit of everything that enters your body. Take a hard look at your pill organizer. It is not enough to simply know you take fish oil and aspirin. We must know the exact milligrams and the specific concentration of the omega-3s. Look closely at the label. You are looking for the total EPA and DHA content. This number is what truly determines your blood thinning potential. Write this specific number down. Next, you must identify every single hidden source of blood thinning. Many seniors forget that painkillers or joint creams they use occasionally are major offenders. Do you use ibuprofen or naproxen for a sore knee? Even if it is a gel you rub on your skin, the body still absorbs some of these compounds. They absolutely increase the stress on your stomach lining when combined with your daily aspirin and the heightened potency of the fish oil. Check your cold and sinus medications. Many contain NSAIDs. Check your arthritis treatments. Check any prescription meant to manage pain or inflammation. You must assume that anything meant to reduce pain is also thinning your blood until proven otherwise. Stop the guesswork. Create a precise, comprehensive list of every medication, every single supplement, and every over-the-counter remedy you use regularly or occasionally. This list is your shield. The most important step you can take right now is scheduling an immediate consultation with your primary care physician or your pharmacist specifically about the aspirin fish oil interaction. Do not just wait until your next annual checkup. This risk is too high to defer. When you go, bring the detailed list you just created. Do not just hand them the list and say, "Is this okay?" You must ask very specific questions that force a detailed review of your bleeding risk. Ask them to perform a bleeding risk audit. Specifically ask, given my current dosages of aspirin and my omega-3 concentration, what is my estimated level of risk for an upper gastrointestinal bleed? Request blood work to establish a baseline. Ask your doctor if checking your platelet function or performing an INR test is appropriate. While the INR test is typically used for strong prescription anticoagulants, it can give insight into your overall clotting status. If you are on prescription blood thinners, drugs like warfarin, Eliquis, or Xarelto, you are already at an extremely high risk. Combining these powerful medications with even low-dose fish oil and aspirin must be discussed with the specialist who manages those prescriptions, usually a cardiologist or hematologist. Never make a change based on a video, only change based on personalized medical advice. Now, what if your doctor confirms that the combination is elevating your risk, but insists that the aspirin is essential for your cardiovascular health? This is a common and necessary dilemma. If aspirin cannot be stopped, we must look at the fish oil. Your doctor may recommend lowering the total daily intake of omega-3s, or they might suggest cycling the fish oil, taking it for a month, then stopping for a week, to allow your platelets some time to recover their function. Crucially, some people take high-dose fish oil solely to manage high triglyceride levels. If that is your situation, ask your doctor about FDA-approved pharmaceutical omega-3 products. These products are manufactured to specific standards, and their dosages are much better controlled and tracked than standard over-the-counter supplements. They also require careful monitoring. If you are taking fish oil primarily for general inflammation reduction, joint pain, or cognitive support, you must consider safer alternatives that do not carry the same gastrointestinal risk when combined with aspirin. You can often achieve significant anti-inflammatory effects through powerful food-based sources. Increase your intake of fatty fish directly rather than relying solely on the supplement capsule. Mackerel, sardines, and wild salmon are potent. Look to spices and natural compounds with documented anti-inflammatory properties, such as high-quality turmeric and ginger. Discuss incorporating these into your diet with your doctor. Remember, even concentrated herbal remedies can interact with medications, so always seek approval. For joint pain specifically, ask your physician about supplements like glucosamine and chondroitin. While their effectiveness varies person to person, they generally do not carry the same immediate blood-thinning profile as omega-3s or NSAIDs. The path to proactive safety requires vigilance, not fear. We have discussed the biological mechanism of the danger, the subtle signs of bleeding, and the immediate steps to take if trouble arises. Now you have the tools for prevention. Remember that internal bleeding is often silent until it is severe. The feeling of fullness, the subtle metallic taste, the unusual fatigue, these are the red flags we discussed earlier. Never minimize a symptom just because it seems minor. If you feel any change in your normal digestion or see any change in the color of your stools, even if you think it might just be something you ate, you must alert your doctor immediately. Do not wait for things to worsen overnight. Protecting your stomach lining is protecting your life. You have the knowledge now to manage this dangerous hidden interaction. Take that comprehensive list of medications and supplements, call your doctor today, and ask for that vital bleeding risk audit. We will continue exploring the essential steps in maintaining a strong, resilient digestive system as you age, focusing next on the 3 overlooked dietary changes that strengthen your gut wall against daily medication stress. But for now, act immediately on what you've learned about aspirin and fish oil. Your safety depends on it.